Hi, today we're talking a little bit more about the differences and use of high-powered laser therapy or photobiomodulation therapy versus extracorporeal shockwave therapy, ESWT. And I find a lot of practitioners are not sure whether they should be using both, one or the other, and how they exactly work. So let's go into that in a little bit more depth. When we talk about shockwave therapy, we're talking about those shockwaves going into the body. Think about pure energy going into the body as those shockwaves, and what they're creating are cavitations. Think of cavitations as like when you open a soft drink can and you get tiny little bubbles. They're going to change the energy in the area, increasing blood flow that comes into there. And that's where we're really getting some of that change and that more acute inflammatory event. It's not actually the pulses that are causing the trauma, it's these cavitations or bubbles. Now, in contrast, what we're seeing in photobiomodulation therapy, PBMT, is we get an increased supply or increased efficiency of ATP production within the mitochondria. Very different effects, both increasing the blood flow. Now, what we find with PBMT is that because we're increasing energy in particular, rather than potentially just blood flow, we've also got a lot of other different enzymes and inflammatory markers that are being created at the same time. Now, when we look at the research to use one, neither, both of them in combination, it's very hard to say one is better than the other, but we do see that when we look at the evidence in comparison and comparing the two when used together, that they are typically going to find a significant difference in combination. And what we're looking at there is that, we're basically creating, there's a lot of sort of people that will say, do you do one or the other? And I love this controversial topic. For myself, I'm a laser before shockwave because we know the laser therapy is going to reduce the sensitivity of our nerves. It's going to start activating all of that healing that we're wanting. And then when we come along with the shockwave and create those cavitations, it's already going to have a lot of blood flow coming in there from the actual action of what we're doing there in those cavitations. But the laser therapy, the photobiomodulation therapy, is going to help bring that back up a lot quicker and allow us to heal a lot quicker as well. But when do we use both? PBMT is used in the chronic and acute, whereas the shockwaves used more commonly in the chronic type of pain. Now, why do we use PBMT in both chronic and acute? Because it's increasing energy, it's increasing the healing, it's reducing that swelling, whether it is chronic or acute. What are we doing with the shockwave therapy? Why is that only, or typically for most conditions, only in the chronic phases? And that's because we are causing a bit of tissue damage there. And it's really good at bringing those sort of chronic tendinopathies in particular back into that acute inflammatory phase so that we can start that healing and inflammatory process again. Now, the next question we get quite often is PBMT versus shockwave. When are we using those? And what I'm pretty severe in my approach to recommending my PBMT, which I use predominantly. And I usually say 3 or 4 sessions that first week, 2 or 3 sessions that second week, and then 1 or 2 that third week. It's a real intensive, let's get this healing, let's get rid of the inflammation, let's get rid of the pain. Whereas the shockwave is using that typically weekly for 3 to 5 sessions and 3 to 5 weeks, depending on how they're responding. Of course, with all of these, if my patient after 3 sessions on the first week of the laser's going so well, I'm just going to say, okay, let's just do once the next week or maybe twice, and then build it out from there. I might very quickly go to fortnightly if patients are responding quite well. But hopefully this has given you some really good information there. Love to see your comments below and any further questions. Cheers.